children in the United States play some type of sport, and every year about 3.5 million of them are taken to the ER with a sports-related injury. These injuries can be tricky in growing bodies, but as Local 10's Christy Kruger reports, surgeons have found an approach that avoids further injury with long-lasting results.
Memorial Miramar's pediatric rehab is bustling with young athletes who've had sports-related injuries.
Kids are playing sports year-round. They're on traveling teams. They're on all-star teams. They're being recruited and scouted at a very young age. And so there's demands on them. And those demands cause them to practice, play more, and get injured more.
When that injury lies near a child's growth plate, the surgery can be risky. Some doctors would even opt not to do surgery until the child is done growing, leaving the young athlete unable to play.
Nowadays, that's not really feasible. Kids want to get back on the field of play. Sports is part of their social dynamic, and taking them out of sports has led to such issues as depression, social withdrawal.
Dr. Jeremy Frank, a pediatric orthopedic, has trained in a procedure that allows doctors to repair an injury without damaging nearby growth plates.
It's surgery that was invented more or less up at Harvard, and very few people actually practice pediatric sports medicine. The vast majority of the sports medicine doctors you see are very qualified adult sports medicine doctors, but it takes a special level of training to do the pediatric component of it and be cognizant of that growth plate.
11-year-old Zachary Smith went through the surgery after tearing a ligament in his knee.
We did a special surgery utilizing a strip of tissue on the outside of his knee called the IT band, and we wrapped that around his knee and reconstructed his ACL that way without drilling through any of his growth plates.
With good rehab, Zachary should soon be back to swimming and golfing with his friends.
He's a very active kid, and I know he's missed being able to do all of the things that he normally does. So I think that's what I'm looking forward to most.
Doctors used to think that a pediatric repair was really only a temporary fix, but years of follow-up have shown the repair can last as long as the area is not re-injured. With your medical report, I'm Christy Kruger, Local 10 News.
Well, that's interesting. And also for those